Back for part two of our conversation with Dr. Jeff Harp from Highland Family Medicine. Good to see you once again.
Likewise.
So last week we talked a lot about asthma. We mentioned COPD. These are obstructive lung diseases. Let's get first an overview of what we're talking about here.
So basically both diseases involve trouble getting air out of the lungs. So when a person's having problems, it takes them a long time to push the air out, or longer than usual. With asthma, the lungs return to normal function when they're doing well. With COPD, there's always a problem there. There's damage to the lungs.
All right, let's dive a little deeper. What symptoms does COPD give?
Generally, shortness of breath, coughing. For many people, a lot of mucus production, so they're always coughing up a little bit of stuff. Those are the main things that people experience.
The causes?
So the causes in the United States are primarily smoking, cigarette smoke exposure. But all throughout the world, it's really exposure to particles. So pollution, air quality is a big factor. And then also there's some infections that can lead to damage of the lungs that can do the same thing as the pollutants do in the smoke.
How is it diagnosed?
So basically it's diagnosed based on symptoms and really through looking at lung function. So there's some lung function tests that physicians do that involve taking a big breath and then blowing through a tube and looking at how much air people can push out, how fast, and so forth. And on that basis, that diagnosis can be made.
You say it's kind of always there. How do you treat it then?
So basically, because it's always there, unlike asthma, which can be treated with intermittent treatments, COPD really has to be treated all the time with medicines to prevent inflammation and to help the lungs function a little bit better.
Okay. And more information on both asthma and COPD if I'm looking to get more information?
More information, the American Lung Association has a local chapter and also a website that's really excellent. The CDC always has a page that helps people understand this and other diseases, so those are two good resources.
And you can always pay a visit to your primary care clinician as well.
That's right.
Doctor, thank you.
You're welcome.
I appreciate both installments of our latest series here, both asthma and COPD. These segments on our website and those links as well, you'll find them at rochesterfirst.com.